I am Councilmember Emmanuel Remy, and I'd like to welcome you to our New American and COVID-19 Vaccinations Town Hall, where we will learn about the vaccination process, accessibility, and we will be dispelling myths today. It has been a long time commitment of mine to make City Hall and city services more accessible to all residents of Columbus, especially residents who identify as New American, Immigrant, and Refugees. This is why today's town hall is so important. A reminder that this town hall is currently live on the YouTube and Facebook pages of City Council and is also live and being recorded for rebroadcast on CTV, Columbus's government television channel 3. The rebroadcast schedule is available at www.columbus.gov. If you're watching this on Facebook Live or YouTube, please put any questions you may have regarding COVID-19 or vaccinations in the chat. We are monitoring these chats for questions to ask of our guests throughout the event. I want to recognize any of my other colleagues here today. I know that we had President Hardin was going to join us, and then most of my colleagues will either be popping in and out, but certainly be watching as we are broadcast as we tend to our busy schedules. I also want to welcome and thank our guests today, Dr. Frederick Burtley, the President and CEO of COSI, Dr. Mysheika Roberts, the Columbus Public Health Commissioner, and Philip Tanjong, the Columbus Public Health Immunization Director. For over a year now, we have been living through the COVID-19 pandemic with safety restrictions, face masks, and the hope of vaccines. We are not done battling this invisible virus, but we are fighting back. I'll be the first, and I'm sure not the last, person to ask you during this town hall to please get your COVID-19 vaccine. My hope today, through the words and presentations of our wonderful guests, is that you and others watching will feel comfortable enough and motivated to get the vaccine now. Or you will reach out to a family member or a friend who has been hesitant about getting vaccinated and share with them the information you learned during this town hall. You will learn how to access the vaccine and more about the vaccine options available in Central Ohio. We will also dispel myths being heard in our community. Before I turn the floor over to our first guest, we have a short video to show you.
Dr. Burtley, president of COSI, but I'm also an immunologist. There's a lot of misinformation about what's inside the COVID-19 vaccine. Truth is, there's just a few simple ingredients: water, sugar, salt, fat, and most importantly, a building block for protein that teaches your body how to recognize and fight COVID-19. That's less stuff than a candy bar or a can of pop. And the vaccine can save your life. And that's why I'll take the shot.
Thank you. So without further ado, I'm excited to turn the floor over to Columbus's own Dr. Frederick Burtley.
Councilman Remy, hope you can hear me. Thank you so much for inviting me to this great group. I want to give a shout out to Professor Tanjong and of course my favorite clinician, Dr. Mysheika Roberts, who's really just been a godsend for not just Columbus, but Central Ohio in terms of getting people to understand what's going on during this pandemic. So thank you for being on this panel. Very important content. I do want to say, and I know you know this, but just the audience, you're going to see me disappear after my short 9 minutes because I actually have a board meeting at the same time, but I thought it was so important you invited me, so I wanted to be on. So after my presentation, I will jump off. Real brief, I have 9 minutes. I'm going to share my screen and just talk some basics about vaccines. So let me make sure this works. Can you all see my screen okay? Is that all right? Thumbs up, someone?
Good.
Okay, great. So you're seeing Twitter at Frederick Burtley. I don't do these plugs, but I actually managed to avoid social media for 20 years. I just jumped on for the first time 2 months ago. So feel free to follow me at Frederick Burtley if you want to hear some more stuff. All right, so science of coronavirus. Let's jump right into it. One thing that's just fascinating to all of us that we should appreciate is as humans, we have 20,000 genes. These are the bits of DNA that make us you, make your kids you, etc. right? If you compare that to a fruit fly, 13,000 genes, right? Bacteria in your gut or out there in public, 600 to 5,500 genes. When you think about coronavirus, it only has 14 genes, yet it's completely wreaked havoc across this country, across the world. And that's just a unfortunate but true fun fact that this tiny little thing is so bad. All right, let's jump into vaccines. People always wonder, well, what is a vaccine? How does it really work? And the concept of vaccine is it's really to play off of your own immune system. All of us, all 7.7 billion people on the planet are born with an immune system. Every now and then you get the bubble boy from the 80s and 90s, somebody that has a weird kind of immunodeficiency, but most of us have a functioning immune system. That's the system that protects us day in and day out from bad stuff. But every now and then you get a bad bug that's so bad it can replicate at high numbers and overpower your immune system. You can get sick, have a lot of symptoms, and worst case scenario, you could die. So the concept of a vaccine is it takes our own immune system. So it's building off of what God or whomever you believe got you here gave you to protect yourself. And it adds some strength to it, some training to it. And it takes your immune defense system and it makes it stronger so that if you do get exposed to this bad bug in nature, now you have a much stronger immune response. You can control it, rid it, and be okay. Fine. How do you make a vaccine? Well, first you come up with an idea. I want to do this. I want to stop Ebola. I want to stop HIV. I want to stop coronavirus. And you come up with something in vitro. Vitro is Latin for glass. This is in a test tube. You show that it works. You get a few cool bits of data. And then you're like, okay, you ask for permission to do an animal study. The first animal studies are done in mice or rats or gerbils, etc. And you show that your immune vaccine candidate can maybe work. Once you can publish that in a peer-reviewed journal, and this is the most important thing I want you to remember, this stuff is validated by other scientists. You can't work in your basement, come up with this concept and think, oh, it's great, and then publish it in the dispatch and think it's going to go anywhere. It cannot. The process of science has thousands of people replicating what you're trying to do. Once you show it works in mice or gerbils, then you go to what's called non-human primates, monkeys. And I don't take this lightly because I've worked in animals. It's not fun, unfortunately, because monkeys are like little babies, they're like little humans. But if you're trying to eradicate disease, these are some of the steps we need to take. Once you can show it can work in a non-human primate and that vaccine candidate works, then you apply a third time now to the Food and Drug Administration to do what's called the clinical trial. You publish your information, you show that it's been peer reviewed, they say great, and then you apply and you're authorized to do what's called a clinical trial, which Dr. Mysheika Roberts will talk all day about. When you hear clinical, that means in humans. So these are trials that are now done in humans. And there's normally 3 phases, phase 1, phase 2, phase 3. You show it works in all those phases. The first phase is just to make sure it's safe. By the time you get to the third phase, it's to make sure not only is it safe, it's actually protecting you against the disease of interest, in this case, coronavirus vaccine. So that's how vaccines are made. Let's talk specifics about coronavirus vaccine, right? Well, real quick, to understand what the vaccine is trying to do, it's important to understand what the virus does in you, all right? So just follow the red arrows. This is your virus. It binds to a receptor, it gets inside your cell, and it uses your own cell machinery. So it's like going in your kitchen, using your kitchen, cooking up your food, eating your food, and then it leaves after it replicates, right? That's what a virus does. It hijacks your immune system. But what's interesting about the virus, it doesn't break through your door or your window like a burglar might do in your house, but it actually uses a key to get inside your cell. Right? Specifically, if you think about how a wet piece of paper, a little sticky on a marble countertop, it's a little sticky, but you could pull it off, right? Well, compare that to Velcro, right? Velcro is that much stronger. And that's how SARS-CoV-2 binds. If you look at the binding, it's that little green thing on the bottom right that's in a circle. That's the receptor. That's the key in the door that will allow the virus to come in if the virus has the key. In the case of COVID-2, it has the key, it puts the key in the keyhole, and it enters. That's where almost all the vaccines that are being developed, certainly the Johnson & Johnson's, Moderna, and Pfizer that we're using in the US, that's where the vaccine is working. It's stopping the virus from infecting your cell. So it doesn't mean the virus might not get exposed to you, but it's going to minimize the capacity for it to get into your cell. If you look at a prettier picture, on top right is blue, that's the virus, bottom right is your cell. You can see the key and lock interaction. That's what's happening, and that's what the vaccine goes to block. In case of the ones we have out right now, we have the DNA, RNA versions for Moderna and Pfizer, and then Johnson & Johnson's is a combination of recombinant viral vectors with DNA, right? In short, what does it mean? It means we put in your body, as you heard from the commercial, so thank you for playing that, Councilman Remy. There's not a lot of stuff in the vaccine, but the important part for the actual immune reaction is a little bit of RNA or DNA, and that RNA or DNA gets produced into proteins, and you make these spike glycoproteins. When you hear the term coronavirus, those bumps around the outside, that's the spikes. That's what gets made in your body, and those spikes end up being released at very, very high numbers. And what happens, the release of those spikes activate your immune system, in particular your B cells, and your B cells produce what you all hear in the media all the time, antibodies. Lots and lots of antibodies, and these antibodies are specific for coronavirus. So now, if you get exposed to coronavirus, as Councilman Remy said, he's happy he has a second shot. Well, now that when he gets exposed, or if he gets exposed to coronavirus, he's going to have antibodies in his body that are going to block the virus from entering, using that keyhole metaphor to get into his cells. So now we have the vaccine. Everybody's worried about safety. Real quick, it is very complicated to get a vaccine and very thorough to get a vaccine approved here in the US. It's much more stringent than all over Europe. But in case of the FDA in the US, one, you look at the company summaries. Two, you look at the manufacturing process. How are they building it? Then they literally look at individual data. So when you hear these studies are 10,000, 30,000, 40,000, these folks are looking at each of the 40,000 candidates and how they're responding to that, and then anything else in clinical. That would be good enough, but United States of America goes one step further, right? They actually convene this thing that you've heard about in the media all the time, this Vaccine Advisory Committee. It's important to understand these are not government employees. They don't work for the FDA. They don't have any shares in any of these companies. These are men and women who are expert immunologists who know the science, who look deeply at the data. And they're the folks that say, okay, this data looks okay. We're giving you emergency authorization. Wait a minute, something's wrong here. We're not authorizing it right now. So, and the last thing that's really important for all of us to know is all of this information is available to us. It is open and available to the public. So this is unbelievably transparent. So when we say the vaccines are safe, we're saying they're safe based on this incredible analysis that happens. And once that happens, it's approved. Then first we had Pfizer, then we had Moderna, now we have Johnson & Johnson's. And I know there was a hiccup with Johnson & Johnson's. We had the 6 women who developed blood clots, and 1 woman unfortunately died. What did happen? Right away, they stopped using the vaccine. Not because it caused those blood clots, but they wanted to make sure that it didn't cause those blood clots. What we found out since that analysis is it turns out, unfortunately, 6 people out of the 7 million people that happened to receive Johnson & Johnson's, 6 people did have blood clots, but it was unrelated. It's kind of like, if you take your car and go for a drive and it's raining outside, you can't say, well, it's raining outside because I drove my car. Those are 2 things that are true, but they're coincidental. And so now the Johnson & Johnson vaccine is back in rotation. Real quick, RNA versus DNA. The first 2, Moderna, Pfizer, RNA, Johnson & Johnson's DNA. Why is that important? At the end of the day, it's important because DNA is really stable, which makes it much cheaper. So when you talk about using vaccines in the developed world, when we go beyond here, and I know this is the first Americans, so a lot of folks have migrated from different areas of the planet. The Johnson & Johnson is that much cheaper because it's made out of DNA. Without getting into details, DNA is super stable, whereas RNA is much more unstable. That's why they need liquid nitrogen, the minus 80 degrees. And so while all 3 of these vaccines and a bunch of others that are available are great options, it's good that Johnson & Johnson's vaccine will be able to come back and play. And finally, the last thing I want to say is everybody's worried about mutants. Yes, there are mutants out there, but it's important to understand, Dr. Mysheika Roberts will tell you, the mutants didn't pop up in March or April we knew last year there were mutants, right? And so now the question is, well, will the vaccines work against mutants? In short, it really depends on where the mutation is in these variants, right? So these are the antibodies that are produced from a vaccine, these upside down Ys. This is what's going to protect you. When you have the original coronavirus in green, you can see the antibody binds to it nicely. The antibody will destroy the virus, protect you from being infected. If the mutations happen in a certain area that don't impact the protective immune response like you see in mutant 1, the vaccine's still going to work great. If, however, the mutations happen in different regions where the vaccine or the antibody can't respond too nicely, then we might be in a tricky situation. Well, it turns out so far, as of now, what we know about the variants, the vaccines are still very protective against them. So with that, if you want to know more, check out QED with Dr. B. It's a really cool show in production with WSU. This is my second plug on COSI. Some really fun stuff. Of course, we tackle vaccines. And with that, thank you very much. And Councilor Remy, thank you so much for setting this up. I appreciate myself and the other distinguished guests to be on this panel. Great job. I look forward to following you as we move forward.
Thank you so much. You can plug any of your events anytime. It's always a pleasure to have your energy and excitement around, and especially about something that you're so knowledgeable about. So we appreciate you being here today. Before you sign, I just want to make sure, Dr. Roberts, Professor, do you have anything that you'd like to say before Dr. Burtley leaves? I guess not. So get back to that board meeting, do some great things with COSI for our youth, and we'll look forward to having or talking soon.
You got it. And again, thank you for your service. Panelists, thank you for being on. And to all you listeners, listen, as we say in Ohio, we're going to get through this together. So thank you so much. Take care, everyone.
Absolutely. Take care. Next, we will hear from our outstanding leader during the past year plus. It seems like 10 years, but we're here, and we're excited to have Columbus Public Health Director or Commissioner Dr. Mysheika Roberts. Thank you for partnering with us today to share important information about our new American immigrant and refugee and immigrant community members. The floor is yours.
Well, thank you, Councilmember Remy, and thank you so much for having myself, Dr. Burtley, as well as my colleague Philip with us today to talk about all things COVID-19. And I love following Dr. Burtley because he just makes it so easy and simple to understand the virus. And what I'm going to really focus on is where we are with cases, and then more about vaccine and where you can get a vaccine here in Columbus and Franklin County. So let me start by sharing a few slides of where we are with cases here in Columbus and in Franklin County. This is a report we post to our website 6 days a week, where we give update information of where we are with our cases. And what's remarkable, and one of the things I love about social media, and I know so many of you are watching today on some social media platform, is I get reminders of what happened a year ago. And one of the reminders I've gotten recently was a year ago around this time, we were reporting about 1,400 cases of COVID-19 in our jurisdiction. So it's pretty startling to think here we are a year later and we've got 88,000 cases of COVID-19 in our community in just 12 months. So this is a virus that is still here. And if you look at countywide, we're almost at 135,000 cases of COVID-19. Now, the good news about this is the mortality rate, or the death from COVID-19, hasn't been as bad here in Franklin County as it has been in other places, but there are still lives that have been lost, and we cannot sleep lightly on that. So here in Franklin County, we've lost 1,500 individuals from COVID-19, and a little less than half of them have come from long-term care facilities. That is exactly why when we initially rolled out the vaccine here in Ohio, we prioritize individuals not only living but also working in long-term care facilities, because we knew it accounted for a large chunk of our cases. Hospitalization rates, although we've heard a lot about hospitals being full throughout the course of this pandemic, our hospitalization rate is at about 3%. Again, not as high as it could be, but it's still high nonetheless. If you look at our male-female gender breakdown, it's about 50-50. A little more females have been hospitalized or have been infected with COVID-19 than males. And the age has ranged from as young as a few months of age to as old as 107. Yes, we did have a 107-year-old individual get COVID-19, and the median age is 33. And then next slide, I just want to break it down by race and ethnicity. And just to put things in perspective, when we look at the population of Columbus, non-Hispanic whites make up about 54% of the population. Non-Hispanic blacks make up about 29% of the population. Hispanic, 6%. Non-Hispanic Asian, 6%. And multiracial, about 5%. So now when we look at our cases, 36% of the cases who live in Columbus have been non-Hispanic white. 21 have been non-Hispanic black, and 8% have been Hispanic. And then you can see another 4% have been non-Hispanic Asian. But when you look at hospitalizations, this is where we see the disparity. And we've heard throughout the pandemic that there's been disparity. This is exactly where we see it. Look at the hospitalizations for non-Hispanic whites in the red, 37%. But look at the hospitalization for non-Hispanic Blacks, 39%. Now keep in mind, 21% of our cases were Black, but 39% of our hospitalized cases are Black. They only represent 29% of the population. So this is where we see that disparity. They are disproportionately impacted by hospitalization. A lot of this has to do with the underlying chronic diseases that many African Americans have, whether it be diabetes, whether it be lung disease, heart disease, hypertension, cholesterol, or obesity. These are all factors that make you have more complications with a COVID-19 infection. And then when you see Hispanics, again, they represent about 6% of the population, but 8% of the cases and 9% of the hospitalizations. When we look at deaths, they somewhat even out, but really when we're looking at morbidity, so how sick are individuals, that hospitalization data is very telling. And that's where we see the disparities. So let's think about age breakdown. And we have this group for the most part in 10-year increments, except for the first 19 years. So the majority of our cases are between the ages of 20 and 29. That has almost been the case throughout the pandemic. Early on, probably like the first 3 months of the pandemic, we saw more of our cases in the age group of 30 to 49. But really, since summer of last year, we've seen that the 20 to 29-year-olds lead in terms of where the majority of our cases are. And then you can see the group for 30 to 39 is second, followed by the 0 to 19. And I will tell you that the 0 to 19 age group has increased pretty tremendously, or significantly, I should say, over the last 3 to 6 months. That group has increased. And some of it is because we brought our kids back into the classroom. Some of it is just, normal epidemiology, but that group has increased as well.
And Dr. Roberts, real quick on that particular point, of the 0 to 19, do they tend to be of the closer to the 19, or is it all across the board?
It's really all across the board, but that's a great question. It's really all across the board, but obviously where we've seen an increase, I would say over the last 6 to 8 weeks, is that 15 to 19-year-old. A lot of that has to do with sports and extracurricular activities. We've seen many cases come about after there's been a game, the team played, and then afterwards they all went and had pizza together or went over to someone's house. Someone was sick, they've taken their mask off, and they've spread the virus that way. So of late, we've seen more cases in that higher age bracket of that 0 to 19 group, but for the cases in general, it's really been all across the board. I will say that the majority of cases in that age group have been mild, and they have not required a lot of hospitalization. So this is what we like to call our Epicurve. And you can see it starts, if you look all the way to your left, back in March when we had our first case identified, March of 2020. And it goes all the way through April of this year. And you see the big peak that we saw starting really in mid or beginning of November and went all the way to really the beginning of February. So that was the large wave or phase that we all were really concerned about. That's when we first went to purple. Obviously, that was before we had vaccines. That was when many people started moving indoors. And so we saw a significant rise in cases here in Franklin County, really all across Ohio and all across the nation. You can see early on, if you go back to look towards your left, you see when we first started, we all were trying to flatten the curve. And so we stayed home, we closed everything down, we took the kids out of school, we all started working remotely. We did a very good job of flattening the curve. Then when we started opening up Ohio late May, mid to late May, we saw a peak right around the 4th of July holiday. We saw a peak in cases. That subsided. We saw another small peak right around Labor Day weekend. that quickly subsided. And then we saw the significant peak in the winter, late fall, early winter. And then recently, at the end of March, we saw a little bit of a peak. And I would attribute a lot of that to the fact that so many people were traveling, whether it was for spring break or other things, and the Easter holiday. And now we're starting to go back down again, which is good news. So vaccines, we have vaccines, and you heard from Dr. Burtley of how effective these vaccines are. Getting the vaccine is the key to getting back to normal. And the quicker we get more people vaccinated, the less likely we will have a chance of creating more mutations. And I love his demonstration of what a mutation looks like. You can't see what a mutation looks like. Only your cells can see that. But the key to reducing mutations is getting people vaccinated. So Columbus Public Health is one of many vaccine providers here in Franklin County. We are the only drive-through vaccine clinic that is operational 6 days a week at the Celeste Center in Franklin County. And since we've opened the vaccine clinic at the Celeste Center, which we opened right after Christmas, actually it was December 26th, we have vaccinated 138,000 individuals. Of those, about 56,000 were second doses. We do offer Pfizer, Moderna, and Johnson & Johnson at the Celeste Center. Primarily, we're focused on Pfizer and Johnson & Johnson. We have a few doses of Moderna left that we are trying to use up. But in addition to the services we provide at the Celeste Center, just this week, we started operating our immunization clinic here at the health department. So Monday through Friday at the health department, you can come in anytime between the hours of 9 a.m. and 4 p.m. and get vaccinated. Here we offer the Pfizer and the Johnson & Johnson vaccine. You can make an appointment by calling us at 614-645-1519, or you can go on our website, columbus.gov/coronavirus, and register for appointment. Or you can just walk in, and we do take walk-ins again Monday through Friday, 9 to 4. In addition to what we're offering here at Columbus Public Health at 240 Parsons, we are operating the Celeste Center. That is a drive-through clinic. We really ask you to be in a vehicle to come through that. We do take people on bikes, motorbikes, and cycle bikes, but we prefer a car. It's safer for everybody. That is operational Monday through Saturday. Most days we are operation 9 to 4:30, but on Tuesdays and Wednesdays we operate from 11 to 6:30. On Monday, Wednesday, Friday at the Celeste Center, we offer Pfizer only as a first dose. And on Tuesday, Thursday, Saturday, we offer Johnson & Johnson as a first dose. You can make an appointment, again, by calling us at 614-645-1519 or going online, columbus.gov/coronavirus, the same information I shared about our clinic here at the health department. Or we will accept, as we call them, same-day appointments. We don't want to call them walk-in because you're not walking into the fairgrounds. You're going to be in a vehicle. We do take same-day appointments at the fairgrounds 6 days a week, again, Monday through Saturday from the hours of 12 noon to 3 p.m. There are other vaccine providers in town. We are not the only one, but that is an option for you. We've tried to make it as convenient as possible. In addition to that, we are doing what we call outreach or pop-up clinics in the community. If I'm not mistaken, this Monday we are at Barnett Rec Center, and we will be there between 12 and 6:30. Again, you can make an appointment or you can just walk in and we will get you vaccinated. At that clinic, we will be offering both Pfizer and Johnson & Johnson vaccine. Just to remind you a little bit about the 3 vaccines that are on the market. As Dr. Burtley said, there are 2 messenger RNA vaccines. That's the Pfizer and the Moderna. Those 2 vaccines require 2 doses. Each, for the Pfizer, the 2 doses should be no less than 3 weeks apart. And for the Moderna, the 2 doses should be no less than 4 weeks apart. You need to get both doses to be fully protected. And for the Pfizer vaccine, you're getting about 95% protection. For the Moderna, it's about 94% protection effectiveness after both doses, 2 weeks after both doses. The Pfizer vaccine is the only vaccine that is available for anyone 16 years of age and up. The Moderna is approved for anyone 18 and up, and the Johnson & Johnson is approved for anyone 18 and up. The Johnson & Johnson is a single dose vaccine. And so the beauty of that is, like people like to call it, it's one and done. And for people who are needle phobic, who might not want to have the time or make the time to come back for a second vaccine, that might be the preferred vaccine for you. Again, we try to make both options available for individuals who want the vaccine. And again, getting vaccinated is the key to getting back to normal and is the most effective tool we have to reduce the number of mutations in our community. So I think that's all I have for my slides. I know that my colleague Philip, who manages our immunization clinic, is going to talk you through what to expect if you show up at one of Columbus Public Health immunization clinics and what you need to bring or not bring with you to those appointments.
Thank you so much, Dr. Roberts. It's so critical for our residents to understand why and how to get their COVID-19 vaccinations. I actually went to the fairgrounds, got my own. I remember freaking out because I couldn't find my blue card the second time around. And you know what? It's okay. If you don't have it, they'll give you a new one. But a very smooth operation. And I think everybody will be impressed with it, that go through that particular one, how easy it is, and certainly painless unless you count the shot itself. So before we move on to Mr. Tanjong, I'm going to turn the floor over after we watch this short video.
What's up, Columbus? It's City Council President Shannon Hardin, and I am excited. I'm excited because I just got my vaccination, and I got it right here in my neighborhood at Equitas Health by my good friend and my Spelman sister, Dr. Olivia Nathan. And as of this past Monday, you and everyone 16 years old and up can too. It's been a hard year for many of us, and this vaccine will help us begin to rebuild our community. We must all do our part and get one of the 3 vaccines that are available. And that's why I got my vaccine. As a Black man, I know there is skepticism and uncertainty in our community, and rightfully so. However, the fact is that the vaccines are safe. The pandemic is not over, and we cannot let up on all the progress that we've made so far. We must lock hand in hand and stop the spread of this virus by doing our part. We are so close, Columbus. So let's take a moment right now to schedule your appointment. This is about saving lives. So I urge you all to take this step so we can keep our families members safe, our friends safe, and our community safe. And better yet, we can get out and be together again this summer. Thank you.
Of that area, Mr. Tanjong, the floor is yours.
Thank you, Councilmember Remy, Dr. Roberts, and Dr. Burtley for me. I'm very excited to have been part of this exercise. I have worked here at Columbus Public Health for 15 years. All of those years I've worked in immunizations. So immunizations is kind of a passion for me. And here at Columbus Public Health, we do understand the science behind immunizations, and we totally support immunizations. And it's almost a miracle that these 3 vaccines were produced and are as effective as any other vaccines that are already out there. So we have vaccines in the market that have been around for 20 years and more. And these 3 vaccines are as effective and as safe as those other vaccines. So I just wanted to add that out there. I'll be touching mostly on some of the myths and some of the issues that people face in getting vaccines. Sometimes people ask questions, what do I bring to vaccine clinic? How much does it cost? I don't speak English. How is that going to happen? If it is a minor, somebody 17 years and younger, can they go get a vaccine by themselves? So I'm going to try to touch on some of those to further reduce some of the barriers that people face when trying to get immunizations. So whether you come here at Columbus Public Health at an immunization clinic, or you go to the Celeste Center, which is a drive-through, you can. These are some of the things that you would expect to encounter, or that you expect. The first thing is the cost of the vaccine. So the COVID vaccine is totally free to everyone. So you do not have to worry about how much is it going to cost or how much you pay. There's no fee that you have to pay at the time of service, and you will not receive any bill from us. Now, there's some people that have insurance, and we may collect insurance information, but it's just we are allowed to bill for a service fee for just an assessment for you during that visit. But you would never see a bill. If the insurance doesn't pay it, you never see a bill. So the cost of the vaccine is really not an impediment. It's really not a limit for anyone to get this vaccine. Also, what should you bring to the immunization clinic when you come to get your COVID vaccine? You should bring some kind of identification. Now, there's a whole list of identifications that are recommended by the Ohio Department of Health, and that are also adopted by Columbus Public Health. I'm going to go through a few of those. I want to say that we have never turned anybody away because they weren't able to present some form of way of identifying them. So there are so many documents that qualify as a means of identifying you during an immunization visit. So if you have a driver's license or a non-driver's license, if you're a member of an active or retired member of the military, you have that ID. If you have a statement or even a short record from your doctor, if you have census records, adoption records, naturalization certificate, a birth certificate or a birth record, a consulate ID or particular consular, as it is called, a passport or a passport card, a certificate of citizenship, permanent resident card, or any Department of State forms. And basically, I'm not going to list everything. The list is very long, and you can bring anything that has your name and your address on it. It could be your telephone bill or your water bill, something. It's just that we like to be able to identify who you are, because if, for example, there's a recall on a particular lot number that you receive, we want to be able to reach you. So that is the main thing. That's the main reason why we want to have an ID. That ID information is not furnished anywhere. It stays in your medical record. It's not furnished to the government. You should also bring a vaccine record if you're coming for your second shot. For those of you who received the Pfizer and the Moderna vaccine, that is a series of 2. If you're coming for the second shot, also remember to bring your vaccine record that was given during your initial appointment. Now, minors, for people under 17 years or younger, under the age of 18. So Ohio law requires that anybody under the age of 18 be accompanied by an adult, preferably a parent or a guardian. Now, if you're a parent of a 17 or 16-year-old that is coming to get vaccine and you're not able to be there with that your child, you can write a handwritten note and just say, I'm authorizing this person to bring my child, John Doe, to get vaccinations today. And you just sign it and give it to the person. But an adult who is 18 years or older has to accompany the child. And then always include your phone number so that we can always call you to ask screening questions if there were any questions that we needed to talk to you about. Now, some of the challenges that people also face at the immunization clinic is language. So even if you don't speak English, we do have interpreters. We have interpretation services of different kinds. We use, depending on what clinic you go to, we have some kind of video conferencing that we use to find an interpreter for your language. We also have a telephone service that we can call to get interpretation. And also we typically would have a person, an interpreter live on site for some languages. So just wanting to note that when not all languages, some very small languages is very difficult to have interpreters, or may take a long time to get somebody to do interpretation. So if you have a family member or a friend or an acquaintance that speaks your language and speaks English and is able to accompany you to your visit, that would be very helpful and help make your visit go quicker and smoother. I think I've covered most of the challenges that or what to expect when you come to get vaccines. I would just leave it there and see if people have questions, any questions that I didn't go.
Thank you, Mr. Tanjong. We appreciate the information. We do have some questions coming up, but before we dig into the final questions, we have one more video to share. In the summer of 2020, Columbus City Council applied for and received a grant of $10,000 from Welcoming America to create PSA videos about COVID-19 in multiple languages. With a grant match from myself and the partnership of Tariq Terry, we were able to create numerous videos that can be found on the City of Columbus's YouTube page. And so we're going to show you the Fulani video now. If you could play that one, we'd be appreciative.
Hello, friends. I'm Columbus City Councilmember Emmanuel V, and today I'd like to bring you safety and resource information in your native language about COVID-19. We value everyone who calls Columbus home and hope that you find this information useful. On behalf of Columbus City Council, please stay safe.
Assalamu alaikum, bitam ko Mariam. Eden gandi COVID-19 so agasta taw. Nan fof nan ɓeyde ɓureeki. Laamo o hayoɓe masque soron jalt yoɗon goɗɗodiron peli jeegom kadi yoɗon teddin lawɗi juuɗmon ndiyam e sabunde. COVID-19 no sifri ko hoore musoere, tampere ɓandu, manquere fofande e ɗojjo. Kala cohluɗo ballal ko fati COVID-19 mo ala ko docteur windi ina wawi yaade hedde Columbus Public Health. Sa ƴewtima ko fati COVID-19 aɗa foti heddade galle ma balɗe 14 ha ganda a wondani hen. Tinu sa noddanima téléphone ma ko fati contact tracing haaldu mabɓe wallu e balla bandiraɓe ma andude hol jogui ɗum hol jogaki. Bandiraɓe soɗon cohli ko fati ballugol ñamere walla galleji noddu LSS 211 on jarama.
Who produced those videos partnered with Chris to create COVID-19 vaccine informational videos, which are also available online. We have received a few questions submitted from the community, so we'll go ahead and get started. The first one is, have you been vaccinated? How was the process? Where did you go? How did you feel after? So I will say that yes, on Saturday, it will be 2 weeks past my second, and I went over to the fairgrounds, the Celeste Center, through Columbus Public Health to have mine. I had the Pfizer vaccine in my case, and the first time I did get a little bit of pain in my bone area that we were talking about, a little bit on the side that I had the shot. However, the second time, really no side effects whatsoever. And I was talking with Dr. Roberts. Everybody reacts a little bit differently, and so it was in my case it was absolutely easy and was a fairly painless scenario. The shot itself, you can barely tell it even happened. So, Dr. Roberts, what do you have to add as far as that goes?
Yeah, so I agree, could barely feel the needle. Some sore arm was the biggest thing you really felt, and maybe some fatigue afterwards, but that was short-lived. And from everything I've heard from people who've had COVID-19 and everything I've read about people who've had COVID-19, the experience pales in comparison to having the actual disease. So well worth it.
I think the psychological benefits and the feeling of kind of a liberation that because you had the shot, although still masking up, doing all the things that we're supposed to do, there's something to be said about the feeling of being vaccinated. So I think there's a benefit there. Mr. Tanjong, do you have anything to add?
No, just that, I had mine in December. As the healthcare provider, the professional that is directly involved with the public, were some of the first to get this vaccine. And so I had Moderna in December and my second dose in early January. And to tell you the truth, I think I just had my tetanus shot like maybe several months before that, and I felt more pain from the tetanus shot than from the COVID vaccine. Now, people are different, but this just, for me, I just had a little soreness on the side on the second day, and the third day it was gone, both for the first and the second.
Thank you so much. I appreciate all that insight. We did get a question online, and I think it's important to preface that these all three shots are very highly effective, but somebody did ask in general, what percentage of effectiveness does the J&J shot have against the other options, and how would you respond to that, Dr. Roberts?
Sure. Well, I would just say, I think even though we talk about effectiveness, it's very hard to put the three vaccines we have now on the market side by side and compare them equally, because they're not the same. As Dr. Burtley shared in his presentation, the Pfizer and the Moderna are messenger RNA. So they're much more delicate. They have to be kept at a different temperature. They're very fragile. The Johnson & Johnson vaccine is made on more of a DNA or an adenovirus platform, more hardy, can be stored at various temperatures, and obviously is a single dose. I will also say that the Johnson & Johnson vaccine clinical trials occurred much later in the course of the pandemic than the other two vaccines. So what do I mean exactly? So the Moderna and Pfizer clinical trials really started happening around February or March of 2020, where the Johnson & Johnson clinical trials didn't start happening till summertime. And so we know that there were some variants that had already started to exist by summertime, and were growing in popularity, so to speak, or growing in magnitude from the summer to the fall to now. So while the clinical trials were happening for the Johnson & Johnson, some would argue that it was more of a real life experience of what we're seeing today. because when the clinical trials were happening, the early ones for Pfizer and Moderna, that's when most people were at home. Most things were closed down, so we didn't have as many variants. So that all being said, the effectiveness does vary between the three vaccines. The Johnson & Johnson vaccine has an effectiveness anywhere between 66% and 74% effectiveness, compared to the Moderna and the Pfizer that after 2 doses, they report an effectiveness of about 94 to 95% effective. But I will warn you that the Johnson & Johnson clinical trials occurred in countries where we know we have variants, like South Africa and South America, where we have both the South African variant and the Brazilian variant. So again, the what Johnson & Johnson had to deal with through their clinical trials, what that was exposed to, what individuals were exposed to, those individuals were probably exposed to more variants than individuals who were in the Pfizer and Moderna clinical trials. But what is the most important is when you look at all three of the vaccines that we have on the market right now, all of them are 100% effective at reducing hospitalization and death, which is ultimately what we really want to stop.
Yeah, I thought when that Johnson & Johnson came out, I kind of wanted just to get one and done, just to be, the ease of use on that one is so nice compared to the other two. But certainly I was willing to take any and every one that they wanted to just stick in my arm. That's for certain. Let's see here. We have, where can someone go and find information regarding vaccine facts and dispelling myths so they can share it with their family members who may still be hesitant to get the vaccine? Dr. Roberts?
So that is a great question. And I am so glad you asked, because you are probably the most influential person in your family and friends' life. They are more likely to listen to you as a family member, as a coworker, as a neighbor, than they would listen to me. They know you. So I would encourage you to go to the CDC's website, cdc.gov. They've got great information, great graphics, great ways to share the story, to dispel the myths that you can share with your loved ones, your neighbors, your coworkers, and encourage them to get vaccinated. If not for them, do it for you.
Very good points. Another question that came in. My grandmother doesn't speak English. Can I fill in her information when setting up her vaccine appointment online or over the phone?
So you can do either. And as her family member, you can be her surrogate for filling out her application over the internet. When she comes and on that application on the internet, whether you do it by internet or phone, we ask you what's your preferred language, so that when you show up at the clinic, we will be prepared to make sure you have the appropriate interpreter that you will need.
Oh, that's excellent to know as well. It's been mentioned already, but since it's a question that's been asked again, are there any costs associated with getting the vaccine?
Well, as Philip said, the vaccine is free. We did not pay for the vaccine, and we will not charge people for the vaccine. However, we do have staff that we are using to give this vaccine. And so we have to kind of do our best to recoup some of those expenses. So for those people who have insurance, we will bill your insurance for what we call an administration fee. If your insurance pays it, that's great. The city gets to recoup some of our expenses for putting on these clinics. If your insurance doesn't pay it, we just toss it and say, oh, well, we'll never send you a bill. We'll never say your insurance didn't pay this, so now you have to pay. So there is no expense, no out-of-pocket expense for the individual getting vaccinated. Again, if you have insurance, we will bill. If you don't have insurance, you'll still get treated with our excellent care, no matter what type of insurance you show up with, whether you have it or not.
See, I didn't even know that until tonight. So I know they asked for my insurance card, but wasn't sure about the back side of it, how that works. So good to know. That happens to be it. All the questions that we've had tonight. Are there any final thoughts from you, Dr. Roberts or Mr. Tanjon?
I can go first by just saying as somebody of an immigrant background himself, and I just want to encourage people to do this for themselves and for their families, and as a way of us all as a community getting back to what we know as normal. So the vaccine is safe. There's nothing to be afraid. There are very few people that cannot get this vaccine. The contraindications are very specific that almost anybody should be able to get this vaccine. So there's no excuse to get the vaccine, not to get the vaccine. There's no cost, and we're trying to make it as easy as possible by scheduling community clinics, by opening up different hours. So I highly encourage all of our community members to take the first opportunity.
And thank you, Philip. You see, I have a very dedicated team that I get to work with here. So appreciate Philip and all he does and his team does. I would just say, to just piggyback on what Philip said, make sure you get valuable information. These vaccines are safe. As you heard from Dr. Burtley, the United States has an extremely rigorous approval process for not only vaccines, but medication, much more rigorous than any other country. So if you're talking to loved ones or friends that live in other countries outside the United States, they might have different experiences from vaccines. They're also not getting the same vaccines that we have here in the United States. So I would really make sure you get information from us here at Columbus Public Health or from the Centers for Disease Control and Prevention at cdc.gov. If you have other questions that we haven't gotten answered tonight, or if you think of things afterwards, or you have family and friends that have questions, we do have a call center. And on that call center, we have nurses available. So you can call 614-645-1519 and talk to a public health nurse. You can say, I have a question for a nurse. I have a medical question. And we will connect you with a public health nurse that works for us here at Columbus Public Health, and they will be able to answer your questions about the vaccine. As Philip said, almost everyone who is 16 years of age and older is eligible for this vaccine. There are very few cases of people who should not get the vaccine or should be cautious when they get the vaccine. So if you have questions and wonder if you're one of those people, that's what our nurses are for. But I will tell you that people with peanut allergies have gotten the vaccine. People with cancer have gotten the vaccine. People with autoimmune diseases have gotten the vaccine. There's very, very, very few reasons why people shouldn't get it. And really, it's not shouldn't get it. It should just be more cautious getting it because you could have a small reaction to the vaccine. So again, the way to get back to normal, the way to control the spread of this virus in our community is for all of us to roll up our sleeves and get vaccinated. And vaccines are readily available. There's no more waiting in line, waiting for hours. Everyone's eligible who's 16 years of age and older. Please get vaccinated.
Another last minute question just came in under the wire. When can children under 16 get vaccinated?
That's a great question. So the FDA, really the companies, so both Moderna, Pfizer, and J&J are doing clinical trials right now, working with that lower age bracket. We anticipate before the end of the summer that the 12 to 15-year-olds will be able to get vaccinated. And then we're optimistic that by January of 2021, kids under 12 will be able to get vaccinated. But probably before we go back to school in the fall, the 12 to 15-year-olds will be eligible. So it's close. We're just not there yet.
Thank you very much for that answer. Well, before we bring this town hall to a close, I do want to thank the community for their engagement during the town hall and their commitment to keeping our neighbors safe. This is very important to get this message out. And as Dr. Roberts said earlier, you are the best messenger to your friends and to your family. So take the information that you've learned tonight and make sure that you tell people how safe it really is and how easy it is to get vaccinated. Collectively together, we will make a difference, and we'll make Columbus one of the safest places to be if we all go out and get vaccinated. I do want to thank our guests tonight, Dr. Frederick Burtley, Dr. Mysheika Roberts, and Mr. Philip Tanjong for your expertise, advocacy, and commitment to keeping Columbus residents safe and educated as we continue to battle COVID-19. We couldn't do this town hall without the assistance from Angela Burks, Mark Carter, and our CTV team to help with our technology needs and connecting us to you and the community. A big thank you to Sandra Lopez for organizing this and putting this together, and Stanley Gates from the Council Community Engagement team for their assistance in making this event a reality. And I couldn't do this, and certainly not the last but not the least, thanks to my team, Jeffrey Carter and Lucy Frank, for their efforts in preparing for this town hall. It really was a great experience. Couldn't have been happier with the results and the guests that we had tonight. So I want to wish everyone a great evening, and remember, get vaccinated, Columbus.